Hello everyone, welcome back to my channel. In this video I am going to discuss about the anatomy of mandible bone. The mandible is the strongest bone of the face. It is also known as lower jaw. It is the only bone which is movable in the skull. It is horseshoe shaped, as we can see. The structure of the mandible has been divided into two parts. First is the ramus of mandible and second is the body. So there are two parts, the ramus and the body. This body has two surfaces. This is the outer surface and this is the inner surface. Two borders are there in the body. This is the upper border, this is the lower border. Now we discuss them one by one. First is the outer surface. Outer surface of the body presents a foramen. This foramen is known as mental foramen. This foramen gives passage for mental nerves and vessels. On the outer surface, we can appreciate an oblique line extending backwards from the mental foramen up to the anterior border of the ramus of mandible. This is the oblique line. On this oblique line, we have attachment of two muscles. In the anterior part, we have origin of depressor anguli inferioris, and in the posterior part we have origin of depressor anguli oris. This oblique line continues upwards to the coronoid process of the ramus of mandible. Then close to the alveolar process, here we have origin of buccinator muscle. And this is the lower border. Close to the lower border over here we have origin of platysma muscle. This platysma muscle is lying superficial to the investing layer of deep cervical fascia. So deep to the origin of platysma muscle, over the lower border we have attachment of investing layer of the deep cervical fascia of neck. This is the upper border of the body. This is also known as alveolar border, as it is possessing the alveolar sockets for the articulation of teeth. Then we come to the inner surface of the body. Inside we can see there are four tubercles. These are genial tubercles. The two tubercles are superiorly located, that is why they are named as superior genial tubercles. They are giving origin to genioglossus muscle. Then there are two inferior genial tubercles. These inferior genial tubercles, they are giving origin to geniohyoid muscle. Then we can see there is a line on the inner aspect of the body. This is known as mylohyoid line. This mylohyoid line gives attachment to mylohyoid muscle. This muscle forms the floor of the mouth. Just below and behind to this mylohyoid line, we had this mylohyoid groove. This mylohyoid groove lodges the mylohyoid nerves and vessels. Then below to the genial tubercles, we can appreciate these depressions. These two depressions are known as digastric fossa. They are giving origin to anterior belly of digastric. This mylohyoid line divides the inner surface of body into two fossa, a lower fossa and upper fossa. This lower fossa lodges submandibular gland and this upper fossa lodges sublingual gland. Then anteriorly, the two body, that is the two parts of the body, they are united, and this is known as symphysis mentae. This symphysis mentae in the lower part presents a tubercle or a prominence. This is known as mental protuberance. Here we have origin of mentalis muscle. Then we come to the ramus of mandible. This is the ramus. It is having two surfaces. This is the outer surface and this is the inner surface. First, we discuss the outer surface. This is the outer surface which is roughened because of the attachment of masseter muscle over here. Then, the angle between the ramus and the body, this is known as angle of mandible. This angle of mandible is everted in case of males. Then we have the inner surface of the ramus. This inner surface presents a foramen over here. This is known as mandibular foramen. This mandibular foramen gives passage for inferior alveolar nerve and vessels. So inferior alveolar nerve passes through this foramen. Before passing into this foramen, inferior alveolar nerve provides a nerve or a branch which is known as nerve to mylohyoid, which runs in this mylohyoid groove. Close to the third molar tooth, over here we have a relation of lingual nerve. Lingual nerve comes at this point, which is very closer to the third molar tooth. Then we come to the borders of the ramus. This is the anterior border, this is the posterior border, and this is the superior border, and this is the inferior border. Over this superior border, there is passage for masseteric nerves and vessels. That is why it is known as mandibular notch. Closely related to the posterior border, we have the parotid gland. This rounded process is known as condylar process. The transverse diameter of this condylar process is more than the anterior-posterior diameter. This condylar process superiorly it is covered with fibrocartilaginous rim and forms the temporomandibular joint. This triangular process is known as coronoid process, and this gives attachment to temporalis muscle. Then, close to the third molar tooth over here, we have origin of superior constrictor muscle of pharynx. Then, just below the head, this constricted portion is known as neck of the condylar process, or we can say the neck of mandible. Over here we can appreciate a flattened area. This flattened area gives attachment for lateral pterygoid muscle. Then again we come to the inner surface. On the inner surface of ramus, here we have this roughened area. This roughened area is for the origin of medial pterygoid muscle. So basically, mandible provides origin for muscles of mastication. Then, mandible can be used for determination of age of a person, that is, whether it is belonging to a child, to an adult person, or to an old age person. This mandible bone belongs to an old age person. How? Here we can see the alveolar processes. They are absorbed after removal of the molar tooths. So here we can see the absorption of the alveolar process and this mental foramen lying close to the upper border. This determines that this bone belongs to an old age person. In case of adult mandible, here we can see because of the eruption of the tooth and development of lower and upper borders, the mental foramen lies in between or in midway between the upper and the lower borders of the body of mandible. So this is the mandible which is belonging to an adult person. Another point which can differentiate between the mandible of a child or an adult person is the angle of mandible. The angle between the ramus and the body in an adult mandible ranges from 110 degree to 140 degrees. In case of old age person or in case of child, this angle is more than 140 degrees. So in this way we can determine the age of a mandible. So this is all about the mandible. I hope you understand well. Thanks for watching.